Modesta reporting there from New York. We can talk now to Ashish Jha, the director of the Harvard Global Health Institute in Boston. Professor Jha, great to see you again. We've been speaking to you over the last few months, and you've really been stressing the importance of locking down and testing, but it doesn't feel like the politicians are listening to the scientists.
Yeah, so thank you for having me on. Some political leaders are. I think a lot of the governors have done a very good job of keeping the states locked down until the number of cases really declined, and then opening up slowly and carefully with good testing and mask wearing. But other governors have not, and other states have not. And those states that really ignored the warnings of scientists, ignored the evidence, are unfortunately seeing large surge in cases. It's very concerning.
But they have been reiterating and feeling the pressure from people who are saying, look, it could be lives versus livelihoods, but we could also die from hunger, for example, or from the loss of employment.
No, I'm sympathetic to that. And that has been a constant argument. I think the key in my mind, if you really want to get your economy back, if the number one goal is the economy, then what you want to do is you want to suppress the virus so it's not rampant in the community. I'm worried that when I look at places like Arizona, I don't think their economy is going to do very, very well in the context of major outbreaks. I think it's going to cause real fear in people, and people are not going to want to go out to restaurants and bars if the outbreak gets any worse.
How are hospitals in the US faring at the moment?
Yeah, so this is obviously a source of big concern, because hospitals, when they start getting full, it's really late in the game. That usually by the time hospitals get full, 2-3 weeks of really high number of infections has already sort of been baked into the system, because people get sick late in the course of this disease. And we're seeing a lot of hospitals now starting to fill up in Arizona, parts of Florida and Texas. And I think politicians don't understand that they're really late on this. They've got to react more aggressively to curtail the spread.
We are seeing parts of Europe starting to open up. Certainly here in England, we had an announcement in the last few minutes. Do you think, though, that the US has opened up too early, too quickly?
Absolutely. I mean, if I look at the data from Italy, for instance, which was hit so very hard, they stayed locked down enough to bring their case numbers way down. The United States didn't. I think we got impatient. We heard from some political leaders that this was not a big deal. This was no worse than the flu. And ultimately, a lot of states opened up against the evidence and against the advice of scientists. And now we're seeing a very high level of cases in many parts of the US, and no real plan to curtail that and bring that down.
I mean, we're seeing over 2 billion infections and 120,000 dead.
Yeah, and we're early in the pandemic, right? That's the key part here, is that I'm expecting by the fall we're going to hit 200,000 deaths, and we won't be done. And so unless America gets its act together, it will end up being a standout, a true exceptional nation in terms of mismanagement of this pandemic.
Professor Jha, we'll have to leave it there. Thank you very much for joining us there from Boston.
Thank you.